early skin-to-skin contact between a mother and her newborn has been shown to have a number of positive effects on attachment, growth, nutrition, and sleep. Despite this knowledge, newborns are still often separated from their mothers for prolonged periods immediately after birth. We're pleased to have Dr. Jae Kim, an associate professor of pediatrics at the University of California in San Diego and the current research chair of the California Pediatric Association, to come here today to discuss how we can institute policies that allow mothers and infant attachment with his presentation, Skin to Skin, the Magical First Moment.
Thank you. Well, good morning, everybody. It gives me a great pleasure to talk about this topic, and I appreciate the AAP for the kind invitation. I want to spend the next 20 minutes or less to talk about a early golden hour, which we term, and there's a situation that occurs that was obviously very evolutionary and natural that we're really trying to bring back into practice in the nursery and at the time of birth. And a lot of people interchange skin to skin with kangaroo mother care, and I'll use it somewhat interchangeably, but there are other elements to kangaroo care that are different. And just to be Disney friendly, I thought I'd put a couple of ears on our baby. So what is skin to skin? Skin to skin contact really reflects a very simple practice of having a naked baby skin touch that of the mother right after delivery and for a period of time thereafter. And one can apply a diaper or a hat after that point, and also have the baby in a comfortable prone position with flexion posturing and avoiding any of the pressure points. This is something that many hospitals have moved towards and are much more familiar with. What's really fascinating is this very early physiologic response when a baby is able to connect with the mother. And people have described a sensory skill that the baby has in being able to detect cues by olfactory glands, and actually there are wonderful videos that you can capture on the internet of babies crawling on a mom's chest and actually sensing where the nipple is and moving towards that and actually getting to a state of breastfeeding. And some people term it the wah to the Z, where the baby is able to start crying and then getting into a relaxed mode and then being able to actually get access to mom's breast. And I want to read this from an article. According to mammalian neuroscience, the intimate contact inherent in this place or habitat evokes neural behaviors ensuring fulfillment of basic biological needs. This time may represent a psychophysiological sensitive period for programming future physiology and behavior. And it's a wonderful statement of how rich this experience is at the very first few minutes of life. We believe the benefits of skin-to-skin contact are threefold. One, in the whole experience of the physical interactions. That could be both from the temperature, touch, and the sensory stimulus, and including the olfactory sense. In early breastfeeding responses, access to colostrum, and benefiting short and long-term aspects. And then emotional bonding, which is harder to measure, but very, very critical to early infant development. And there is this wonderful, rich communication that happens on multiple sensory levels that the infant and the mom exchanges. On a vestibular sense, where the infant can actually sense the vibratory movements of the mom's breathing and chest movement. On an auditory sense, where the infant can detect the mom's voice and the sounds of her heartbeats and her breathing. And on a tactile sense, the physical touch of just the skin-to-skin contact, as well as mom's hands bracing the baby. And as mentioned, also the olfactory sense of really having a connectivity of at a sense, at a smell level. We believe that there are multiple benefits that people have captured, both for the term and the preterm, and I'd like to share some of that summary of data for you. But some of the high points have been maintaining body temperature, having a physiologic stability around heart rate, breathing response, and blood pressure, normalizing blood sugar, having less crying, and having a much better response to breastfeeding, which I'll spend a little bit of time on today. Many people shy away from this whole concept of having a naked baby exposed and having the fear that temperature would be a problem and having hypothermia to the baby, but in fact it's the complete opposite, that babies who experience skin-to-skin interactions with mother actually have better temperature control, and in fact they're really sitting on a human radiator, and the mom is providing that wonderful radiant heat to the baby. And some data suggests that the stimulation of oxytocin actually increases the temperature of the breasts, which further augment temperature control. If you look at the data really spreads around the time period of how much skin-to-skin exposure these infants have, whether it's a brief time early, right after birth, all the way out to a continuous period throughout the whole stay of hospitalization. And a quick look at the Cochrane review will indicate for term-healthy newborns that the kangaroo care or skin-to-skin contact really augments the ability for these infants to breastfeed at 1 and 4 months, and the duration of breastfeeding trends towards longer overall. And for the late preterm infant, the cardiorespiratory stability is definitely very positive. And then blood glucose control is also very, very positive. A lot of these studies are mixed and varied and happen across the world, and I do have to say that the quality still needs to improve in order to provide improved data, particularly with long-term benefits, although some of these studies are emerging. I wanted to focus a bit of time on this whole connection between the skin-to-skin care and breastfeeding, because that connection is very, very strong. And for those of us who are really trying to push to have reached some of the loftier goals like Healthy 2020, where we want to have more babies who are exclusively breastfeeding, this is really one of the important strategies that we can implement. And the message from the AAP, as we all know, is that we are really targeting exclusive breastfeeding for the first 6 months and at least some access to breastfeeding even all the way up to the first year of life. And in order to achieve that, many of us have leaned on the Baby Friendly program, which is an international program, and we have one locally in the US, that really drives standardized care in order to improve the healthy term newborn getting access to human milk and to getting breastfeeding established. And one of the steps in the 10 steps of the Baby Friendly is this having mothers helped to initiate breastfeeding within the first hour of life. So for those of you who are within hospitals that are trying to get baby-friendly status to improve overall breastfeeding, this is one of the difficult challenges in order to get moms and babies together really quickly. So I want to cover how people have been able to achieve this. And when you do look at the data of connecting skin-to-skin care and breastfeeding, you'll see that skin-to-skin can dramatically improve the breastfeeding success rate, half the time to actually start or initiate breastfeeding, and improve the satisfaction of both the mother and the family, and also have an increased amount of exclusive breastfeeding in those babies. And so maternal-infant early skin-to-skin contact significantly enhanced the success of first breastfeed and continuation of exclusive breastfeeding to 1 month of age, in addition to reducing the time to initiate first feed and time to effective breastfeeding. Now, this is not an Instagram modified picture. This is a vintage photo of how we used to do it. And unfortunately, there are still many units that drive a nursery in this matter where babies and moms are hugely separated. In modern day now, when people now try to create the rooming in model or the mother-infant dyad, you'll now see mother and child connected right at the time of birth. And although this mother doesn't look that happy, she's actually just sleeping, so she really was very pleased to be with her baby. And so the nursery just relegates to a small procedural room in our hospital, for instance, and then most babies are now coupled with their moms. So at our hospital, which is a baby-friendly hospital at UC San Diego, we have been able to successfully have normal vaginal birth babies have a very high incidence of being able to connect with moms by skin to skin and establish some early breastfeeding. And even in the normal C-section delivery babies, having a high success rate in getting these babies on top of their moms. And so for most of our babies in our hospital, we're able to achieve that nice golden hour period. Now, this is a take-home message for this crowd, and my pediatricians in my hospital really wanted to push this concept that we as pediatricians play an incredible role in really affecting this change. It's not just about the nurses that deliver this care, but it's about the physicians making a strong message how important that is. And in fact, after a physical exam takes place, the pediatricians in our hospital make a very special point to get babies back to mom or to dad, as in this case, to really make that effort, that an emphasis of how important skin-to-skin contact is. And we try to avoid using a lot of baby clothing so that skin-to-skin contact can actually be encouraged. And just as a reminder, important to tell parents that if they are falling asleep or asleep, they need to really be cognizant of trying to get their babies back to sleep in their cribs. We've had a few incidences that were not happy stories. How do we fare in the NICU? Because this is the efforts that we have in the term infant, but I spent a lot of time as a neonatologist in the NICU, and interestingly, the data, especially around kangaroo mother's care, really emphasizes the benefit of skin-to-skin care or contact in the preterm area. And when we look at how we deliver our care to the preterm infant, who obviously are more vulnerable, we run into some trouble. One of the biggest issues is how we warm our babies. We do not warm them through a proper radiant method. We blow hot air into an incubator, we encapsulate everything in there, and every time you open up the incubator, there's this exchange of cold air, really stressing the infant. There's very minimal true good skin-to-skin physical contact throughout most of the day for these infants, and they often are very troubled in being able to establish good sleep patterns. There's a lot of painful procedures that occur throughout the period of time that they're with us, and a tremendous amount of handling. So we don't do a very good job from a physiologic, from a biologic point of view. A lot of reasons are obviously important that we have, the reasons why we do that. And so how can we look at this whole area? And one of the driving forces of this whole area of skin-to-skin contact was in kangaroo mother's care, which was derived from in Bogota, Colombia, where they actually looked at continuous skin-to-skin contact to try to help deal with overcrowding in their units. And their concept was actually continuous contact, continuous skin-to-skin contact, where infants were attached to their mothers, bound to them, and really carried them even after discharge. And the driving points were skin-to-skin contact, having early breastfeeding established, and earlier discharge. And that was really one of the bases of how a lot of this practice increased. If we looked at the Cochrane data looking at this specific area of low birth weight infants getting skin-to-skin contact or kangaroo care, we'll see that there's dramatic changes, even more so than in the term infant. And this is reduction in mortality, reduction in nosocomial infection and sepsis, reduction in hypothermia, as mentioned before, how important that is, and then reduction in length of hospital stay, and then more minute measurement differences in terms of growth, breastfeeding parameters, and even mother-infant attachment benefits. And there's definitely very strong reasons why this is a wonderful model to occur in resource-limited settings, but certainly we've benefited a lot seeing this in our own unit here in the US. In terms of short-term benefits, there are other things that people have found in smaller studies, particularly reduction in stress and pain response and this normalization of all their physiologic parameters, so they actually seem happier and more comforted in this setting. And then long-term, some early data to suggest that the cognitive development is better, that the attachment, mother-infant attachment seems to be stronger. And if you look at some of the animal literature, it's really profound how much early separation can affect the long-term physiologic and psychological health of that pup. And then positive effects on motor development, positive effects on colic, and of course on breastfeeding, as mentioned already. And one of the powerful things that I think is important, and we see this in the unit all the time because a lot of our moms do skin-to-skin care in the NICU, is this improvement in sleep response. That having that skin-to-skin contact really improves the infant's ability to have much more mature, deeper sleep, and studies demonstrate that this is in fact very much the case. So I think we can make a very strong case right now, especially in the family-centered model in the NICU, that we should be pushing for more and more skin-to-skin, because a lot of this does not happen in the country, in the U.S., to improve that maternal-infant bonding, the infant physiologic stability, and really to drive more milk production, which is really a huge objective of ours in the NICU. And I think parents should be encouraged when they walk into the NICU to be able to ask and request for daily skin-to-skin therapy. So we in San Diego developed a very similar program to the baby-friendly program to drive home a quality improvement, programmatic change in preterm infant nutrition, which really tried to harness some of the benefits of skin-to-skin contact, early human milk intake, and make it both move from a regional program to really a national platform where we can standardize how we deal with preterm infants and their nutrition. And these are our recent parolees that escaped. And our website is open to all access to everybody, spinprogram.ucsd.edu, and we really encourage dialogue so that we can have improved standardization across the country. Now, how do you actually introduce this kind of practice into a hospital? And it's like anything else. I think it's a critical thing, and certainly something we learned with our programmatic development. It's important to standardize the practice, and you do this by gathering all your stakeholders that are really key in this area and empowering them to be able to target certain objectives, take one step at a time, not do all the programmatic changes at once, and develop a broad-based educational platform to teach everyone, because everyone has to be part of the equation, especially for something like skin-to-skin contact, where you have nurses and faculty over in the labor and delivery area, as well as in the nursery and the NICU. And most importantly, whenever the endeavor is to do quality improvement, it's important to have some measure of the benchmarks that you're really targeting for to be able to measure your success or failure. And a lot of the barriers that people have touted in this area have been in not having the right kind of information and having fear or discomfort about the whole process. And it's really critical that if we overcome a lot of these barriers, because a lot of times it's just about getting everyone to the same table, having the same talk, and realizing the information is not that complicated, and the practice is actually relatively easy to implement, even when it comes to very vulnerable babies in the NICU. So that's the end, and I hope I've impressed upon you the importance of skin-to-skin contact and the derivatives that fall out of that, including the access to more human milk and the improvement in breastfeeding parameters for our babies, and that this really is an essential part of delivering that wonderful golden hour to all our babies. So thank you for your attention.